assessment, and care during first stage. Objectives of the session. At the end of the session, the learners will be able to describe the first stage of labor, explain the physiological process in the first stage of labor, describe the assessment for the woman during the first stage of labor, explain the steps of vaginal examination during labor, explain plotting and interpretation of partograph, describe the care for the woman during the first stage of labor, describe the equipment and supplies in the labor room and newborn care corner. First stage of labor. This is the period from the onset of true labor pains to the full dilatation of the cervix. Duration 12 hours in primigravidas, 6 to 8 hours in multigravidas. This stage is divided into two, latent and active phases. Latent phase, not in active labor. Cervix is dilated less than 4 centimeters. Contractions, weak, less than 2 contractions in 10 minutes. Active phase. Cervix is dilated more than or equal to 4 centimeters. Contractions become stronger, 3 to 5 contractions in 10 minutes, each lasting more than 20 seconds. Cervix dilates at the rate of 1 centimeter per hour, usually not more than 12 hours. Physiological process in the first stage of labor. The first stage is mainly concerned with the preparation of the birth canal. The major physiological process in first stage are fundal dominance, polarity, contraction and retraction of uterine muscles, formation of upper and lower uterine segment, retraction ring, cervical effacement, cervical dilatation, presence of show, formation of bag of membranes, rupture of membranes, fetal access pressure. Physiological process of first stage of labor. Uterine action. Fundal dominance. Contractions start at fundus of uterus near the cornua, near the junction with fallopian tube, and spread across and downwards. Contraction is longest and intense at the fundus. Peak is reached simultaneously and fades from all parts simultaneously. Polarity. It is a neuromuscular harmony between two poles of uterus. Upper pole contracts strongly and retracts to expel the fetus. Lower pole contracts slightly and dilates to allow expulsion to occur. Contraction and retraction. Characteristics of uterine contraction. Intensity is the degree of peak, tightness, or hardness of uterus. Intensity changes as labor progresses. Frequency. Measured from beginning of one contraction to beginning of next contraction. Duration. Time from the beginning of one contraction to the end of same contraction. Retraction. During relaxation, muscle fibers retain some tone of contraction instead of becoming completely relaxed and is termed as retraction. Formation of upper and lower uterine segment. Two segments develop during later part of third trimester, the upper and lower uterine segments. Upper segment, mainly concerned with contraction and retraction. It is thick and muscular. Lower segment, distends and dilates and is thinner. It develops from the isthmus. Upper segment becomes gradually shorter, thicker, and its cavity diminishes, pushing fetus into the thinner lower segment, pelvis, and out of birth canal. Retraction ring. It is a ridge between the upper and lower uterine segments. Gradually rises normally, not visible over the abdomen. In obstructed labor, it becomes visible above the symphysis pubis, termed as Bandel's ring. Cervical effacement. Cervical effacement is the progressive thinning and shortening of the cervix. Effacement is measured in percentage like 25%, 50%, 75%, or 100%. In primigravida, the effacement usually occurs prior to the onset of labor, and in multigravida, it occurs simultaneously with cervical dilatation. Cervical dilatation. Cervical dilatation is the gradual opening of external OS from being closed to full dilatation. Cervical dilatation is measured in centimeters from 0 to 10. Mechanical factors. Formation of bag of waters. As lower segment forms and stretches, chorion becomes detached from it, and increased intrauterine pressure causes loosened part of sac of fluid to bulge downwards from internal OS. Well-flexed head fits snugly into the cervix and cuts off the fluid in front of the head from that which surrounds the body. Sac of amniotic fluid bulges downwards from internal OS, known as pore waters, and surrounds the body is known as hindwater. Rupture of membranes. Spontaneous rupture occurs at the end of the first stage of labor after the cervix becomes fully dilated. Fetal axis pressure. During each contraction, uterus rises forward and force spondal contractions transmitted down the long axis of the fetus. More significant after rupture of membranes and during the second stage of